My name is Allie Ryder. I'm a physical therapist here at IM Health, and I have been here for 2 years. So there is something really special about working with a person who couldn't do something and now they get to do it again. Whether it was pain or whether it was just immobility or just feeling they weren't confident and strong enough to do it, and showing a patient how strong they are and getting them able to do everything they do, whether it's somebody who can't get up and down from the floor to play with their grandkids, or it's somebody who wants to play a sport and get back to that. I mean, that's a really impactful thing, to be able to help somebody do what they like to do. And that's probably what I find most exciting and fulfilling about my job. So one of the things that I do specifically here is I am a concussion and vestibular specialist. So what that is, the vestibular system has a lot to do with balance, dizziness, motion sensitivity, and then we know concussions are head injuries, but this comes in a lot of forms. So I have taken some extra time and some extra studying to be able to treat these kind of disorders, dysfunctions very specifically. So this is, like I said, feeling off balance, feeling sick in a car and dizzy in a car, dizzy with head motions, dizziness with laying down, vertigo, and actually the spinning sensation. So any of these things, there's typically a reason. So what we like to do is I try to figure out what's causing that. If it is a physical therapy problem, if it's something that we can fix with PT, then we do treatment here. We work on a couple different systems of the body, balance, vision. That's a lot of it is what we work on, and then depending if we need to, then I send you out to who else you might need to see, whether that's an ENT, whether that's an eye doctor, whether that's a neurologist. So we work as a team to treat a lot of these disorders, but these can be really debilitating and fortunately have a pretty easy fix for a lot of times. So when I start treating a new patient, the patient comes to me, they always come in with something not working as well as they want to, or there's something they can't do. So that's kind of the driver of everything we're doing, is trying to figure out what's going on that's preventing them from doing what they want to do. What's painful, or it's just like, I want to be able to run. I can do everything, but I can't run. I can't do this sport on the weekend. I can't throw with my kid. So really finding what's most important to the patient is what drives a lot of my treatment progressions. I'm very focused on the hands-on work to help to get a better sense of like what's going on in the body, but then really progressing the exercises. And my goal is always to give the patients something they can do on their own to continually manage long-term, because a lot of times these things are cyclical. They come back if the patient's doing this or that. So just trying to give them the ability to kind of care for themselves on their own long-term is always the goal with my progression and treatment.